Earl, and it's Hump Day with Dr. Alex Earl. We're here at Pure Plastic Surgery today, and this is the time we get to spend together, and I get to answer all of your urine and burden plastic surgery questions. That's right. We can talk about anything from head to toe, and from pre-op to surgery to post-op, including complications and things like that. All right? And you know it's coming from a good source because I am a double board certified, Ivy League trained, or Ivy League educated, Duke trained plastic surgeon, and I've been doing this for over a decade now with thousands of procedures under my belt. I'm happy to answer any questions you may have. But today, before we get into that, we're going to talk about what is new in plastic surgery. There's a few things that have popped out, and by new I say probably within the last year or so. And so I want to talk a little bit about that. Y también le quería recordar a todo el mundo que yo también hablo español, ¿ok? Entonces si tienen alguna pregunta en español, por favor, mándenla por ahí y la puedo contestar en español también, ¿ok? Alright, so, what's new? So I separated into like non-surgical and surgical, and of course these are all things that we either already have here at Pure Plastic Surgery or we are about to be able to provide for you here at Pure Plastic Surgery, okay? And so, one of the things that came out probably about a year ago now is what we call Avili, right? And if I say the word Avili, I'm sure most of you are like, what is that? I've never heard of that before. I don't even know what it's for, right? So what it is, it's a new device that is used to treat cellulite, okay? And that is very important because about almost 9 out of 10 women have cellulite. Okay, and so it's super, super common, and of course, you know, some cellulite might not bother you, but there may be some dimples that really, really, really bother you. And the issue with that is that up until now, there was never really a good way to treat it. Okay, there's a whole bunch of things out there that say they will treat cellulite, but they really don't, right? External creams, injections, all these things. Well, guess what? If you bought any of those things, I'm sure you know by now you wasted your money. It's not going to work, all right? But the great thing about the Avili device is that it actually works because it actually goes to the quote-unquote the root of the problem, okay? So what is cellulite? So cellulite is a dimple in the skin, right? So you have a dimple in the skin, but what's causing that dimple? Well, what's actually causing that dimple are these bands that attach the skin to the underlying muscle, and most typically in the buttock or in the thigh area. And so because that skin is being pulled down by those bands, it causes the cellulite dimple. And so what the Avili device does is that it comes in and it has actually, you place it underneath the skin through a tiny, tiny incision, and it has a little knife or blade there that it comes in basically through the skin and it cuts these bands, okay, and therefore cuts and releases the bands, which then allows the skin to come up so that you have that smooth contour there, okay? So the great thing about this is it can be done in the clinic setting, under local anesthesia. It doesn't require like being in the operating room, doesn't require pre-op labs or any of that stuff. It's basically in and out procedure that you can do in the clinic setting and you're back to normal life. What does it require post-op? You do have to wear a little bit of compression, typically like Spanx type shorts for the first 2 weeks. And that's about it. You can sit, you can do, you know, pretty much normal life, drive, etc., etc. Really no downtime for that. So if you have cellulite, there's finally a good solution for you, and that's what I highly recommend now. Okay. The next thing that's new, which is actually, this is new from this year, but meaning 2025, is what's called Alaclay. Again, probably most of you haven't heard about Alaclay or even know what that is, but Alaclay is actually, I'm going to put it off the shelf fat. OTS, off the shelf fat. Oh man, that's awesome. What does that mean? It's literally fat that I grab off the shelf, I open it up, and I use it to fill up spaces, okay? So this is fat that is coming from other people that has been treated in a way where you can remove all the DNA or genetic material, and of course it's sterilized, and therefore it's not reactive, right? Because say, for example, if I just right now took my fat and I gave it to you, that would cause a very severe reaction, right? So that wouldn't be good. You can't just transplant fat like that in the same way that you just can't just transplant any organ, like the liver or the kidney or anything else. But this particular fat, this Alaclay, is fat that has been treated in a way where all that genetic DNA type material is removed while at the same time keeping the fat cell intact. And that's really the innovation there. That's the new thing that hasn't been able to be done before. And so the fat cell is intact, but it doesn't cause any sort of reactions. That's really, really awesome. So we can use that to fill out, anywhere from small to moderate size areas that need volume. And what really is it's a great for hip dips and thin patients. So if you're a patient who's like very athletic, you have a low BMI, basically not a lot of fat between your skin and your muscle, BMI is like whatever, 19, 20, 21, but you have hip dips and you're not a great candidate for the BBL because you don't have enough fat, well, this is a great solution for you. Now we can use this off-the-shelf fat, put it in the dips, and round out those hips. Because remember, exercise does not cure a hip dip, okay? There's no such exercise that you can do to make a hip dip better, because a hip dip, is a lack of volume. There's no muscle there. There's no muscle to work out. It's simply a lack of volume. So if you want to fill it out, you need to add volume. If you have your own fat, that's the best solution. Use your own fat, which you can do it when you're doing the buttocks as well, such as the BBL. But if you don't have your own fat, then boom, Aloclay becomes a solution for you. Aloclay also works great in the breast. If you want to have like a little bit of a moderate enhancement of the breast, or if you have perhaps you have a little rippling where you see your implant and you want to smooth that out, it's a great solution for that. And the reason why it's so great is because look at the category it's in, non-surgical. What does that mean? It's just done under local. Again, another office-based, clinic-based procedure. Done under local, you're in, you're out, there's no downtime, there's no anesthesia, no general anesthesia, no need for labs or any of that nonsense. You're in, you're out, your hip dip's fixed, boom, and you're on your way. Once again, for this also you're going to be wearing a Spanx or a compression type short for the first 2 weeks, okay? All right, so that's the new stuff coming out in the non-surgical side. What is the biggest deal coming out right now on the surgical side? Well, you've heard me probably, seen my sign, you've heard me talk about it, and what we're talking about here is rib remodel for a smaller waist, all right? And so the first thing I want to make sure that everybody understands, and I've been really talking about this a lot and posting about this a lot, rib remodel does not mean rib removal or rib resection, okay? We're not taking out ribs. What we're doing is we're causing a very controlled, what we call green stick fracture of the outer part of the rib, so that we can then reposition that rib in a way that it makes the waist smaller, okay? So the great thing about this is it can be done very minimally invasive through a little tiny incision, which is the size of about that, which is an 18 gauge needle. It's done through a little tiny incision through an 18 gauge needle with a very special tool called the piezotome. And with that tool, through that tiny little hole, we can make a controlled incision of the outer part of the rib so that we can do this controlled green stick fracture, bring in the ribs to make the waist smaller. But it does require commitment from the patient after the surgery, because you have to wear a corset for 3 months. Okay? So that's very important for patients to understand. If you don't wear the corset, you're not going to get a good result. So you have to wear the corset for 3 months so that controlled fracture that we made gets solidified in its new position. Okay, so that's the key right there. So rib remodel coming here to your Pure Plastic Surgery. That's going to be starting in September. Okay, September we're going to be doing our first cases of rib remodel, and we have one more thing coming out here for Pure. But right now it's a secret. You all gonna have to stay tuned, all right? But let me just say this. It's in the world of skin tightening, all right? It's basically the newest technology in skin tightening. We're super, super excited about it. We've received a part of it already. The rest of there's a huge technological advanced machine that is coming in. It should be coming in September as well. And as soon as that comes in, we're going to do the unboxing. We're going to tell you all about it. But we're super excited. It's really the next level in terms of skin tightening. Okay? All right. Happy to answer any questions. Shoot.
All right. First question: what age do you stop doing BBLs?
That's a good question. And that is going to vary a little bit from surgeon to surgeon. Okay, so I'm going to tell you my own preference. So my max age limit for BBL is 50 years old, 50. Okay, now I understand, in today's world people live, you can live to your 80, 90, and that seems young. I get it. Okay, but what I've seen in my experience, and I've done probably over 3,000 BBLs already under my belt, is that patients that are over 50, they don't tend to tolerate the surgery very well, so they tend up having more issues with feeling like very weak after surgery, or perhaps needing more IV fluids, or even potentially blood transfusions. That's one on the one side, and of course safety is our number one priority. And on the other side, the patients with it's a skin issue. Doing liposuction on someone that's 50 or above, the skin does not tend to do well after liposuction. It doesn't retract well. It ends up looking like uneven and lumpy and bumpy, and then the patients are usually not happy with that, and also the risk of fibrosis is higher as well.
Okay, this next question I think applies to the rib remodel.
All right. It's from TikTok?
Yes, TikTok question.
What's up, my TikTok fam?
What's the recovery like in the first week?
Yeah, so that's a very good question. So, first of all, it depends if you're doing the surgery on its own or if you're combining it with something else, okay? But let's go simple. Let's say you're doing the surgery on its own. So you're doing the surgery on its own. So if you do the surgery on its own, we can get you into that corset right away. And you're gonna, like I said, you're gonna be wearing that corset pretty much night and day, okay, for the first 3 months. And so what we found is that if you're in the corset, you're feeling pretty comfortable. Okay, and actually the pain is not that bad. Pain is super tolerable. Sometimes you may need some of the Percocet in the first week, but most patients only need it for a couple days, and then they can switch over to ibuprofen. Okay, and so the key thing there is that you want to be, stabilized in the corset. If you decide you don't want to use it, well, that's when it becomes an issue, because then things become unstable, and that can cause pain or a non-union when things don't solidify the way they're supposed to. All right, so that's why I've said it multiple times, because you guys are like, oh my god, he keeps talking about corset. Well, the reason I'm saying that is because it's super, super important. You have to commit to that. You have to commit to that 100%. Okay.
Can I get lipo while being awake?
In general, yes. With me, no. Okay. So are there people out there that do liposuction with patients awake? There are. I personally, I do not recommend it for several reasons. First of all, let's talk about results. Okay, I think you get a lesser result when you do it awake. You cannot be as aggressive with an awake patient. Plus, sometimes the patients are not comfortable. They're moving, they're squirming, and so you're just not able to get the contour that you need. You're not able to remove as much fat as you would like to remove, and so you're just going to have a lesser result. Like, I can't tell you how many patients I have seen throughout the years that they had their first surgery, lipo awake, and they're just not happy. They see minimal to no change. They suffer through the surgery, and they're like, doc, just put me under and and do a great job. Okay, that's number one. Number two, how do you do lipo awake, right? Well, you have to numb the patient, right? And the way to do that is with a medication called lidocaine. Lidocaine helps numb you up, but the issue with lidocaine is that if you give a patient too much lidocaine, that could lead to something called lidocaine toxicity, which can then affect the heart and the nervous system. So it can cause essentially a heart attack or an arrhythmia and potentially seizures. It's very, very dangerous, okay? And so I like to eliminate that factor altogether. I don't use any lidocaine for my liposuction procedures at all, and therefore the risk of having lidocaine toxicity with me doing this under general and zero lidocaine is 0%.
Can I do a Veli with tummy tuck and fat transfer just to my hip dips?
Yeah, so that's an awesome combination. You can certainly do that. So I didn't talk about, what different combos you can do with all of these things. But yes, a Veli, you can pretty much add that to most procedures. You can certainly add it to any breast procedure, mommy makeover, tummy tucks. Even the My Makeover with fat transfer to the hip dips, that's certainly okay too. The only one where we have to be a little bit more careful is if we're combining the Avali in the buttocks with fat transfer to the buttocks, right? So Avali and BBL. If you have a very, very mild case of cellulite, then a lot of times we can combine it. But if you have moderate to severe cellulite, it's probably best not to combine it, okay? It's probably best to do your BBL first and then come back and have your Avali treatment 3 months later.
How will the rib remodel surgery affect skin if you already have loose skin?
If you already have loose skin, I mean, the skin needs to be treated one way or the other. But it has nothing to do with the rib remodel part of it itself. I mean, if you already have loose skin and you do rib remodel, you're still going to have loose skin. But here's the thing. Again, I didn't talk about what combos you can do. You can do a tummy tuck and a rib remodel procedure. And therefore, the tummy tuck will deal with the loose skin. And of course, the rib remodel will help make the waist smaller.
All right, next question. After tummy tucks, is there any risk if you get pregnant?
So there's no risk, like a health risk, okay? So like in that sense, it is okay to get a tummy tuck and then get pregnant. It's not gonna affect you or the baby, okay? Remember, everything that we do for a tummy tuck is superficial to where the uterus is, right? It's all above the abdominal wall or the abdominal muscles. It's all superficial to that. The muscles themselves, get plicated, but that's about it. Nothing is deep to that. However, it's not recommended, right? Because if you do a tummy tuck and then get pregnant, well, everything's gonna stretch out again. You're gonna need a tummy tuck again because you're gonna have loose skin again. You're gonna have muscle separation or weakness again, and then it's gonna need to be dealt with afterwards.
Thank you, doctor. Any pubic lift procedures only?
Yeah, that can be done. Honestly, I'm going to say that it's probably not super common to do it on its own because most patients that have an issue with excess skin or excess fat in the pubic area also have excess skin or excess fat elsewhere. So it's very commonly combined with a lot of the stuff that we do, such as a tummy tuck. That's going to give you a pubic lift. Or if there's excess fat in the area, that can be taken care of with liposuction, Lipo360 or BBL. So having said that, if that's the only thing that is bothering you, it can be addressed on its own.
Hi, doctor. Can I do a lipo after 7 months? After 7 months post tummy tuck, and how long is recovery?
Oh yeah. So I say the minimum time is 3 months. So certainly by 7 months, you're definitely okay. So yeah, anytime after 3 months. You can then do your lipo. And that's actually the way that I recommend doing it if you're going to do both. Like if you need both, then I recommend doing your tummy tuck first and then come back, 3 months or later to do your Lipo360 or BBL.
Does it hurt to recover from Aloclate or does it hurt when it's out in?
Yeah, so that's it. So the good news about the Aloclate is that it's very minimal downtime, very minimal pain. And so really the worst part about the Aloclate is just when we put in the numbing solution, right, the local anesthetic, and that's about it. And then very little pain throughout the procedure, very little pain afterwards. For these two procedures, you don't need any sort of narcotics. You can just treat these with Tylenol or ibuprofen. That's it.
What's better, Morpheus 8 or the new skin tightening?
Oh, you see what this is? You're gonna be excited. This is gonna basically blow everything else out of the water. So yes, I mean, we're super excited about that. But there is, this is like it's under the surgical category, right? This is something that we have to do in the operating room under general anesthesia, as opposed to the Morpheus 8, which is something that's just done in the clinic setting with some topical anesthetic, and that's it. So there are some differences there in terms of how much downtime there is, et cetera, et cetera.
Why does it feel like a lot of procedures are advancing, but when it comes to penis enhancement, we don't have much?
Yeah, so I guess that's, it's just not talked about very, very much. And there's, not a lot of new things. Basically, there's fillers, which can be used, injectables or fat. And that's about it. There's not a lot of new, I guess, technology in that sense.
Between Mederma and bio oil, which one do you think is more effective for healing and fading the scar?
So I think the Mederma works pretty well. Actually, what I think works the best is a silicone-based scar cream. And so Mederma and the bio oils are not silicone-based. So I recommend one that's silicone-based. The one that we like to use here is called Silogen. And I think that works best for scars. It could be either in a cream form or it can be like in a silicone type of patch.
Okay, we have a comment here. Doctor, I can't read your writing.
Oh,
She said
what?
she really said chicken scratch.
Oh no! Yes, that is the classical doctor writing. I apologize for that, but not much I can do about that now. I'm 48 years old. I don't think it's gonna get any better.
And for the rib remodel, do you need massages with that?
Not for the rib remodel itself. Okay, so for example, if you're doing it on its own, then there's no need for massage. Now, sometimes you do combine it with certain liposuction procedures, and so you'll still go through your massages for in the same way that you would for the liposuction procedure. So that part of it stays the same, but you don't need it specifically for the rib remodel.
Let's see here. Okay, TikTok question.
Yeah, TikTok's on fire today.
Hi, doctor. Is the ultrasound only used with your BBL?
Yeah, so when we're talking about ultrasound imaging for guidance, okay, yeah, what the reason, the most important reason that I use it here at Pure Plastic Surgery is for the BBL and specifically for the fat transfer portion of the BBL, right? Because that is the part that is potentially dangerous if you don't know what you're doing, right? If you're a surgeon that has no experience or if you're doing the procedure blindly, then you run the risk of putting the fat deep or into or deep to the muscle, which can then potentially lead to that fat embolism and even potential sudden death, which is what we know, we want to avoid that. So how do you avoid it? Well, you want to make sure that you're putting that fat into that safe space, which is the space that's between the skin and the muscle, okay? And how do you make sure? Well, by turning a blind procedure into one where you can actually see. And so I use the ultrasound imaging so I can see exactly where my cannula is, the device to place the fat, and I can make sure that that cannula is in that safe space. And I've done over 2,000 of these procedures, 0 fat embolism.
Can you combine Alloclave and a BBL?
So yes, you can do that. Say for example, you're someone that has some fat, but not enough fat, right? And so say maybe you have enough fat to like give you some more projection in the booty area, but maybe you're still missing some fat needed for the hip dip area, for example. That's an example where you can do both. So it is a possibility that in order to do that. For the most part, patients that have enough fat just have enough fat to do everything and to do a BBL, and then the thin patients don't have enough fat for anything and they do the Alloclave. But yes, it can be potentially combined.
What's the recovery time for tummy tuck and fat transfer to the hip?
So yeah, so first of all, thank you for that, because I think that is a great procedure. I really recommend that if you want to have a curvier shape, I recommend adding the fat transfer to the hip at the time of the tummy tuck. That's really going to help, bring out that beautiful hourglass shape. All right. The recovery time is going to be the same as if it were just a tummy tuck on its own. So it's not going to add anything in terms of recovery either. So it's going to be 6 weeks of no heavy lifting, no strenuous activity. Most patients are driving around the 3rd week and probably going back to like an office type setting somewhere around the 3rd week. But certainly if you have a job that requires, more physical job or lifting, you're going to have to wait the full 6 weeks.
What's the longest drain should be in?
So for I use drains for my Lipo 360s and BBL. Not all surgeons do that, but I do. Because I think it really helps getting rid of that fluid in the first few days. And so that drain I'm going to remove on post-op day 5, so 5 days after surgery. Now, if you're talking about drains for a tummy tuck, that's going to vary more. It varies from patient to patient. Typically, the first drain comes out somewhere between day 5 and 7. The second drain comes out somewhere between day 10 and 14. The longest I would ever keep the drain in is usually 3 weeks.
Do you perform explant with N-block and lift?
Yeah, so that's certainly something that can be done. So what is she? I assume she. What does she mean by en bloc? It means when you're removing the implant and the capsule all together. And so you can remove it all intact all at the same time. And so you can do that. When you do that, the breast is then going to end up fairly deflated or droopy, and so you need to add a lift then after that to kind of remove all the excess skin and tuck the breast and bring it back up. So so that can certainly be done.
How long after tummy tuck and breast lift can I go back to the gym and lift weights?
So tummy tuck, breast lift. We're talking about mommy makeover. You're gonna have to wait 6 weeks before you get back to the gym.
How long after having a baby should I come in for a tummy tuck?
So you're gonna want to wait at least 6 months. Okay. You don't want to do it any sooner than that. You're gonna give your body a little bit of time to bounce back after the pregnancy and giving birth. We want things to kind of settle as much as we can, and that's usually gonna take at least 6 months. And so then at that point in time, then we'll know just how much loose skin there is, how much muscle weakness and separation there is, and that's going to be the great time for the tummy tuck to fix and repair all that.
Okay, not a question, but I will be having a BBL with you next Wednesday. Please make me a nice butt.
Oh yes, all right, awesome. I look forward to it. I'll see you on next Wednesday. I guess a week from today.
Do you offer financing?
Yes, we definitely offer financing. So we actually offer multiple options for financing, and that's something that's very, very important. So what do we offer? Let's see, just off the top of my head, but there's so many. We offer Care Credit, we offer Alpheon, we offer Affirm, we offer Cherry, and I think that's it, although I might be missing one more, okay? But the good news is there's multiple options out there. That shouldn't stop you from having a procedure. So if you want to learn more about these options, certainly give us a call, and I can have one of our coordinators, or Roxy, who does a lot of the financing here, give you all that information.
How long should I continue wearing my stage 2 faja after my tummy tuck, and for how many hours per day do you recommend?
Great. So, all right. So let's back it up just a sec. So when you do a tummy tuck, like I mentioned a few minutes ago, you are going to have drains. So initially, you're going to be wearing what's called an abdominal binder. It's just this white thing that wraps around you and gives you some support. Once both drains come out, then you can switch to your faja, which you can typically start with a stage 2 type faja at that point in time, which is going to be somewhere around maybe 10 to 14 days after surgery. All right. Once you're in that faja, you're going to be wearing it night and day up until week 6 post-op. And then after that, you're going to wear it 12 hours a day up until week 12 post-op. Okay? And then you can stop.
What happens if I don't have anyone to drive me to my massages after my BBL? Can I use the BBL pillow to drive myself?
That depends on when in the recovery you are. I would say certainly not in the first week. Okay, you're not going to be driving post-op day 1, 2, 3, 4, 5. Okay. After about a week, then you're feeling good enough to drive. Then you can use you can drive yourself with your BBL pillow, etc. But certainly not within the first week. You need to find someone to either drive you or find a massage therapist that can come to you.
Okay, for just liposuction, what's the recovery?
All right, so let's go over liposuction recovery, right? So there is a commitment after liposuction in order to have the best results or in order to optimize your results, okay? So some of the baseline stuff's already there, right? So 6 weeks of no heavy lifting, no strenuous activity. Try to keep the lifting to 15 pounds or less, and no swimming, no submerging the body underwater, okay? But what else do you have to do? So you have to wear compression. Compression is very, very important. You have to wear a faja. For the first 6 weeks, you're going to be wearing that night and day. And then after that, you're going to be wearing it 12 hours a day for an additional 6 weeks until you get to the 12-week mark, okay? And then the next thing is the massages. Massages are super, super important. I am a big believer in post-lipolymphatic massage. And so my recommendation is you have a minimum of 20 massages after surgery. You're going to start as soon as the next day, so the day after surgery. The first 7 massages are going to be daily. The next 7 massages are going to be every other day. And then the last 6 or 7 massages are going to be weekly.
If someone has an umbilical hernia, can they have an any belly button?
If you're having a tummy tuck, yes. Okay, so the only, pretty much the only time, or at least here, I'm addressing a belly button is when I do the tummy tuck. And so when we do the tummy tuck, yes, we can turn an outie belly button into an innie belly button. Okay, but just keep in mind, belly buttons are not addressed when we're doing Lipo360 or BBL.
Okay, I know you have to go soon. Do we have a few more minutes for some questions?
Okay. Are we gonna do? We want to do like rapid fire rounds?
Rapid fire. Let's do it.
Let's do it. Rapid fire. See, I think we can get as many as possible.
All right, let's do it. How long after my mommy makeover is it safe to start sleeping on my side?
So start sleeping on the side at the mommy makeover. I'm gonna say 6 weeks.
Do you offer scar revision for people who were not your patient, and is scar revision possible even when your skin is so tight?
For the most part, yes. But if the skin is tight and maybe you want to wait a little bit longer, maybe you want to wait a year from the prior procedure, and then the scar revision can be done. But the answer overall is yes.
How long after lipo can I travel home and work?
So you're going to be able to travel home 5 days after surgery, and typically most patients are working after a week.
All right, rapid fire. How long do I need to wear the foams?
Foams, you're going to be wearing those for the first 6 weeks.
Can you do breast augmentation without implants after a BBL, or can it be done together?
So breast aug and a BBL, I typically don't combine those procedures. I think it's best not to combine them. I think it's safer not to combine them. But most importantly, the recovery is really, really tough, right? You're supposed to be on, face down for the BBL. You're supposed to be on your back for the breast procedure. And so then it doesn't make any sense. You end up compromising the BBL because you do have to be on your back. You can't be laying on the implants. And therefore you end up putting some pressure on the hips and the buttock, which is going to compromise your BBL result. So I don't like to combine those procedures.
I have a dog ear from a BR reduction. Can you repair? Breast reduction?
Yes, definitely. That can be repaired. And if it's small, it can be done under local. If it's larger, sometimes we need to then do it under anesthesia.
Last question.
All right.
What is spitting suture?
Great question. So what is a spitting suture? So a lot of times when we do all of these procedures, breast, tummies, etc., we place what we call internal sutures. So sutures that are underneath the skin, okay, or stitches, in other words. So sutures and stitches are the same thing. And so what happens is that sometimes your body may reject one of these stitches. And so when the body kind of rejects it, what it does is that it starts pushing it out towards the surface, and then it becomes visible. And that's what we call a spitting suture or spitting stitch. It's usually not a big deal. At that point in time, you just kind of cut it, remove it, and then it heals up.
All right, thank you very much.
Okay, all right, everybody. I like that the rapid round. That's good. We got a lot of questions in. That's great. So, all right, everybody. Well, I look forward to seeing you all